All right, so talking on one of these women issues again, we'll be looking at what's known as a choriocarcinoma. Choriocarcinoma. Okay. So choriocarcinoma is just a rare, it's an aggressive cancer. So it originates from what? Trophoblastic cells. Can I see this? So they call them gestational trophoblastic diseases. So choriocarcinoma is just a type of it. You could see this is what choriocarcinoma. So this one, this trophoblast, they are cells that form the placenta during pregnancy. So they are supposed to come out, form that placenta, that attachment between what the baby and the mother, but they now become cancerous. So they are a part of a group of conditions called the gestational trophoblastic diseases. All right. So they can develop after a molar pregnancy. Maybe the woman had miscarriage. Maybe she had ectopic pregnancy. That's like the baby implanted in a place outside the endometrium. So key facts about the choriocarcinoma is most commonly arises in the uterus, but can also affect the ovaries, the testicles, and other organs. So types have the gestational one linked to pregnancy, non-gestational one outside pregnancy. It could just occur. All right. So spread, that's if it is now moving from benign to metastatic. It can spread to other organs like your lungs, your liver, your brain, kidneys. Of course, most issues of death is due to this spread. Okay. So symptoms: the woman is having irregular vaginal bleeding. She's having so much pain in the area below the stomach. The pain could also be radiating to the stomach. If you check for the human coronary gonadotropic levels, is high. She's weak. She's feeling like to vomit. So diagnosis is this human coronary gonadotropic hormone. You check for the levels. If it's so high, it's a hallmark. All right. The ultrasound, CT scan, MRI, X-rays. This one I just want to look at the cancer. You want to also look at if the cancer is spreading. Pelvic examination, just to review the mass, okay, or any abnormal tissues. So treatment is basically you are dealing with the cancer. So you could do chemotherapy or surgeries just to remove the tumors, radiation therapy, that's radiotherapy, and all of that. Okay, so that's just it for this choriocarcinoma. All right, as a cancer of the uterus, basically developing from what trophoblastic cells that are supposed to form a placenta.